When someone is having a stroke, there is no more time-sensitive condition in all of medicine. You're losing 2 million brain cells a minute. It's absolutely imperative that you have the right team with the right experience that can rapidly diagnose the problem. That decision to come to us may be the most important decision of that family's life.
We have incredible stroke specialists here. The vision of the Stroke and Neuroscience Center is really to expand best high-quality stroke care in the nation to be able to cover all of those patients throughout the region.
So the stroke belt consists of approximately 11 states. Chattanooga lies within kind of the belt buckle of the stroke belt. Patients are of all ages, all races, all ethnicities.
We have a very high incidence of stroke here for a number of reasons. We have a bit of an older population, number one. Number two, our diet very much lends itself to early atherosclerotic disease, and the plaque buildup ultimately lead to stroke.
People need to know stroke. They need to know their risk factors, they need to know the signs and symptoms of stroke, and more importantly, they need to know what to do if they experience any of those signs and symptoms. If you feel like you could be suffering a stroke, then go to the hospital. Call 911.
Every 10 minutes delay takes away 8 weeks of healthy life, and that's why time is the most important essence when it comes to stroke.
I think that for the people in Chattanooga, they would be surprised to know just how much research and how much advancement there is in stroke care, and how much is really going into determining what are the best treatments, what are the best ways that we can take care of these patients to get them the best outcome.
Our team is focusing on advancing care in stroke. We offer mechanical thrombectomy, which is a specialized treatment where a clot is removed from the brain.
We have a large team of people focused on developing tomorrow's new drugs and devices to treat all aspects of neurologic disease.
With the help of advanced technology and with expertise, you're not just saving lives, but actually you are getting excellent outcome.
This very team of people that we're talking about here today worked with the engineers from around the world to train the computer systems to automatically find the clots in the brain. And when the computers found the clots in the brain, an alarm would go off that alerted us that there was a patient at the outside hospital that had a clot in their brain, and then all of a sudden, all of the brain imaging would be pushed to us, and we would have on our phones the full image of the brain, and we could make the diagnosis of the stroke.
So if you're in Fort Oglethorpe, Georgia, if you're in Walker County, Georgia, you're having a stroke and you're brought to CHI North Georgia campus, then there is a cascade of communication to where a stroke specialist is notified that there's a patient experiencing signs and symptoms of a stroke. A stroke neurologist will see you on demand instantly. And at that point, we use virtual care. So we use a high-powered telemedicine camera that has pan-tilt zoom capabilities so the physician can do that really unique neurological assessment on the patient remotely, and then the physician will decide whether or not you need to be potentially transferred for a higher level of care.
Stroke is a very unique disease because you can take somebody that has fallen over a cliff and is about to hit the ground, and if you do this right and you diagnose them quickly and you treat them quickly, you can take a patient that's absolutely on death's door on Monday, and on Tuesday they can walk out of here basically 100% normal.